StarHealth, a dominant provider in the field of retail healthcare, was pioneered and founded by Mr. V. Jagannathan. With over 40 years of experience in the insurance sector, he and his team continually strive for service excellence with a focus on delivering the best to their customers. In today's world of information overload, there is so much of misinformation on medical conditions and treatments. Through its Way to Wellness program, StarHealth is creating authentic medical awareness amongst the masses for their own health, safety, and well-being. So many burning questions on the pandemic and the days ahead. Dr. Prakash, a medical surgeon by training and managing director at StarHealth, has been with the organization since its inception. In this very first episode of the Way to Wellness series, he brings together renowned medical experts, frontline doctors, to discuss the current pandemic situation and how we may continue keeping ourselves safe. Join us to invest in your own health.
We are living in the midst of the pandemic for more than a year now, and still there are a lot of uncertainties with regard to the treatment and the precautions and the preventive methods. So in this context, we thought that we will have a discussion with experts in the field. Ladies and gentlemen, during this pandemic, the people who really saved us, are continuing to save us during this pandemic, are doctors who work in the critical care and ICU areas. So we have invited eminent experts who are very passionate in the field of medicine and who have been saving hundreds of lives during this pandemic. Dr. Ram Subramaniam, Dr. Vijay Lakshmi, and Dr. Sridhar. So I welcome the panelists, and I just want to start with the first question to Dr. Ram Subramaniam on what is the current status. How many people are really affected and how many of them require to go to a doctor and stay in the hospital?
Let us take 100 people are tested positive. There are probably 1,000 people who are having COVID without being aware about it. Among the 100 who test positive, almost 80% have very mild infection which does not warrant any treatment other than paracetamol or symptomatic treatment for their cold symptoms or back pain or headache. Some may even have diarrhea. The 20 who may require hospitalization, again almost 80%, 75 to 80% recover with just a few days stay in the hospital, maybe 1 or 2 liters of oxygen. Only about 15 to 20% who get hospitalized may warrant ICU stay. If you look at the picture as a whole, the chances of you recovering with a mild infection is much more likely to happen than severe illness and death.
The fear of developing a lung problem or a vascular problem, because people hear a lot in the social media. What is the true impact of the disease on lung or blood vessels or any other organs? Dr. Ram, can you brief us?
Regarding the way in which COVID affects the body, even though it is a respiratory virus and causes predominantly a pneumonia, we realize that a respiratory virus was able to cause systemic manifestations. In other words, it was not just the lung which was affected. People used to come up with blood clots all over the place. It could be in the lung in the form of what we call pulmonary embolism. It could be a vein in the leg which had blood clots. It could be blood supply to the intestines. It could be blood supply to the heart, leading to heart attacks. It could be a stroke leading to because of block in blood circulation to the cerebral blood vessels. So it had phenomenal manifestations, and also what we call as a cytokine storm, because during the first week the virus multiplied and caused a lot of problems. But the actual deterioration happens in most cases in the second week, where because of increased inflammatory reactions all over the body, what is called as a cytokine storm, it led to multi-organ failure. And that was how most people, at least during the peak of the pandemic, deteriorated.
So it's a respiratory virus, but it can affect the whole body and cause multi-organ failure. I can understand the intense care that is required particularly when they are very critical in the ICU, to bring them back to life. And once they get discharged, there is an important role to be played in the form of rehabilitation. Dr. Vijayalakshmi, can you help us with what type of physical rehabilitation and mental rehabilitation that is required to these patients who are getting discharged successfully after your treatment?
Basically, one thing was the patients getting discharged varied from 3 days to almost a month. So it was often difficult for us to predict how long they need to be in isolation. So after they get discharged, we told them to be at home for 2 weeks and come back to the post-COVID clinic in 2 weeks. One problem with COVID is, unlike other infections, you can have a physiotherapist go home and train them. You can send a dietitian. Those things are not possible. Nursing became an issue. In the last 2-3 months, we've had some nursing teams staying with the patients. But initially, nurses were not willing to go home and offer care. So it was all through distance and telemedicine stuff. Lot of them in the ICU and post-recovery phase itself had counseling with a psychiatrist. That really helped them. So even in the ICU, as they recover, we used to start them on breathing exercises. So initially just breathing exercises, and then we just used to give them triflometers. Then we started off a post-COVID program following them up for 2 weeks. So some paramedical person used to talk with them, help them with their diet, so help them with their activity level, and then link them back to the post-COVID clinic. When they come back to post-COVID clinic, we used to vaccinate them, assess for their vascular risk, and those who look like having a high vascular risk are referred to the cardiology. And any other organ-related issues, they are linked to that particular specialty. And that's when we complete the loop. So some of the mild infection, that one visit is okay, but moderate to severe used to come back after another 2 weeks and after a month. Severe lung fibrosis, we used to follow them with CT till 3 months. One more CT is taken at 3 months to see how much fibrosis happens, and you won't believe it, somehow the damage to the lung, even with those who are very sick, is like less than what we anticipated initially. Quite a few of them recovered without much of fibrosis, which is something which is new to us. We didn't expect. Rehab goes for, frankly speaking, anywhere between 2 weeks to 3 months.
After your treatment, most of them who get discharged successfully, they have a feeling that they can move around, they can visit their friends, and even they can involve in social drinking. So Dr. Rams, what is your view on that?
Even though most of COVID people settle in 2 weeks' time, in almost 90% of people, they are perfectly fine after 2 weeks. We realize that a significant number may continue to have symptoms, what we call as long haulers. Long haulers are basically people who have recovered from COVID but end up either with some symptoms which may persist, but several of them can develop new symptoms also. To give you an example, dryness of the mouth, disturbance in sleep, appetite disturbances, lack of energy and tiredness, a persistent cough, inability to concentrate. These are some of the common symptoms which people tell me that they suffer from even after the fever goes and all the immediate symptoms settle. And these symptoms may persist for several weeks. And what is surprising is, this is not seen in people who are in the ICU, who are severely ill. Most of these patients have had mild illness requiring 3-4 days in hospital or maybe a few days of oxygen. So we have still got to learn quite a bit how to handle these patients. Lot of doctors seem to ignore or neglect this, saying that the patient is imagining this, but which has not been the case in most studies done elsewhere. Lot of these symptoms, even the simple thing of lack of smell, a lot of people lose their smell, but sometimes the same smell comes back, or most often it comes back within a week or 10 days. But I have seen 3 or 4 cases for over 2 months, they don't get their smell back, and it is very, very disturbing when you can't smell, when you can't taste properly for several weeks.
Do you expect a second surge, Dr. Ram?
Logic and history tells me that second wave is likely to come very, very strongly. All the countries which went through the first wave, India probably is about a couple of months behind most of these countries. All the European countries, UK, USA, Brazil, they've all gone through a second wave, including China. So I can't think of any fantastic reason why India shouldn't go the same way. The chances that we are likely to have a second wave is definitely there. So I may be a realist, but I am still very wary that we have to be prepared, which means early vaccination and continuation of the pandemic messages, wearing mask, physical distancing, and hand hygiene and hand washing, I think should be adhered to for longer.
It's going to be very difficult for us if there is going to be a second surge, and we sincerely pray that Mother Nature should help us in this regard. Dr. Sridhar, as the pandemic started, there were a lot of talks about, do we have enough drugs in India to treat this disease? Then we started thinking, do we have enough beds? Then do we have enough ventilators? But more than all that, the real problem what we faced is, do we have enough manpower? Positive, well-motivated and passionate manpower to continue to work when there is a pandemic, when they have to physically spend their time with patients who are tested positive. So that is a very big challenge. We have to touch the feet of all the healthcare workers who have come forward to handle the pandemic and help these patients. So what was your view, Dr. Sridhar? How did you manage your manpower, particularly ICU? When all beds are occupied, you cannot run your ICU without sufficient, nurses or junior doctors. So how did you manage the manpower?
You're right. I think, I think it's the art of war. I think they say most battles are won before the battle really starts. So once again, we'll go back to the time when we had about 6 weeks to prepare during this pandemic. So we had time to look at the statistics coming out of China and Europe. And we had a meeting wherein everybody was represented, from senior management to doctors to nurses to people who clean the ICUs. And the data was quite clear. The younger you are, the safer you are. Unfortunately, the predominant working force in ICU is female, which by itself is a protective factor. And second, most of them are under 30. So we could see clearly that the maximum risk group was 60 plus, a little bit increased risk for those in the 50 to 60, and then it substantially falls off. So we're able to tell them, look, you're protected by virtue of your traits, that you're fit, that you're young and you're female. On top of it, we were clear they will only take care of patients once we had procured PPE. But by the time, I think India, especially South India, we have enough entrepreneurs to start manufacturing PPE kits. And by the time it hit, I think most of the hospitals had access to PPE, which even countries in the West, we know that American nurses and doctors and British nurses and doctors were sent to the front line without adequate protection and equipment. But we were able to utilize the 6 weeks breathing space we had to procure all the equipment that we need. During this conversation we had, it was also clear that it was not enough, that words would not be enough. We would actually have to continue behaving like how we did. So the senior management who did their ward rounds would continue to do their ward rounds through COVID wards. None of them would shirk. The senior consultants who would turn up to work regularly would turn up to COVID ICU and be there and do the ward rounds like everybody else. So when we lead both from the front and the back, there was no question of anybody backing out, and it was quite clear. This is what we had studied for. This is what we all took our oaths at the end of medical and nursing and paramedical courses, and this is not the time to back away. And I'm pleased to say that despite a lot of pressure from especially our nurses, their families are away in villages in rural Tamil Nadu. They are getting all the WhatsApp messages that we're talking about, and they want their daughter or young son to come back, when not be in the hospital and this happened. Almost all, except maybe single digit numbers, all the nurses and doctors elected to stay. And some of my doctors go back to home. Dr. Vijayalakshmi will talk more about it, to newborn babies and to grandmothers who are 90 plus. They go back home to be with their own families. But all of them stood up. Almost none of them backed off. I think it was during this pandemic that we realized what services were actually essential. We follow, I don't know if I'm allowed to make a comment like this, but I just want to make it clear, we follow superstars, we follow cricket stars, we follow Bollywood gods, but we actually know who were there when the crisis demanded.
You are exactly true, Dr. Sridhar. During the peak of the pandemic, we used to have thousands of our customers, getting affected with COVID-19. And all our doctors in our health insurance company also, they were working from morning to night, and addressing all these claims. And I had a personal experience of talking to the treating doctors. I can understand the stress. So Dr. Vijayalakshmi, can you just tell us, how did you manage this, because, you are from morning to evening, you are in the hospital, and back home, you have to face your children, your parents, your in-laws. How did you manage that situation?
I had elderly parents and they took care of the children. I used to leave them there and bring them back in the evening. So the idea at that time is, I was more worried about my parents. So I and my husband, we decided, we used to have a cook. So if I become sick, that we'll all quarantine, because only from me the child can get it. Only from the child it can go to my parents. So if I get sick, all of us will get quarantined. Fortunately, it didn't happen in the last 1 year. So we didn't get quarantined throughout. So that's how it went. To say it, if you take it from the emotional front, New Year Eve, my daughter told me, what's your New Year wish? She told me saying that, from this year, I want my mother to be more at home and my father not to blast me when I make a mistake. So they really missed us, but then that's part of life, and I think as they grow, they'll forget it, but they learn a good lesson. When there is a crisis, when there is a need, you have to do your bit. You don't have an option, and everybody talks about doctors. We have police people. You won't believe how many police people got admitted, how many of them became very sick. Security force, sanitary workers. It's not just doctors and nurses alone. These people also suffered a lot. The sum of all these people, they are the ones who brought us out of this crisis. It's not an individual, it's a group of people who sacrificed quite a bit. And quite a few of them became sick. We did have mortality. Well, we are back on our feet, and that's what matters.
That's a supreme example of benevolence I can see from the doctors, paramedics and the frontline workers who have helped us to face this pandemic. We are still continuing to face a pandemic. But at this context, how can we further protect ourselves? Now, there is a big news about vaccine, and since 1 month now, people have started taking vaccine. I want to know from Dr. Ram Subramaniam, people were praying for vaccine to come all these days, but once the vaccine is ready, there is a lot of resistance. What is your feeling of it?
It is a paradox, but it is not entirely unexpected. When we realized that there was no specific treatment to cure the condition, we started working on vaccines. Even as early as January last year, work on vaccines started. And it is very commendable that a lot of organizations and scientific brains have come together, collaborated from various countries to produce vaccines at what is now called as warp speed. Warp speed is what you'll see in Star Trek. Zooming through space like that, in such speed they have come out with the vaccines. And the question always comes, are the vaccines safe? For a vaccine, the most important aspect is the safety of the vaccine. And I think all the vaccines which have currently been licensed or given emergency use authorization, we know that they are very safe. The chances of delayed adverse events is very, very small. So safety, I don't think there is any need to question the safety of the vaccines. But how effective they are, we have to wait and see.
Do you feel that the choice of vaccine, how can you help the common public to choose the right vaccine?
It is like trying to get the best and the latest cell phone or the laptop. You'll never get one. You get one today, 2 weeks later another company will come up with a new model with an extra camera or extra battery life or something like that. So you can never reach perfection. So as long as it is safe and it is more than 50% efficacious, I think for this moment that is enough, because that is the most important step we can take to ensure that herd immunity is obtained and the infection can be eradicated. So my earnest plea is, whatever vaccine, if it is licensed and shown to be safe by studies, take it at the earliest so that we can at least work towards getting rid of this infection.
So in India, the number of people affected are relatively less compared to developed countries like US or Europe, parts of Europe. What is your view, Dr. Vijayalakshmi? Why do you think that in India there are less number of people affected? Is something called as herd immunity, is it really happening? Can we really measure it?
Well, the real answer is we don't know 100%, but what we get to know is, by October, we had a trial from Tamil Nadu which said that 20% of the rural population, 30% of urban Tamil Nadu people are already immune to COVID. That means they have some kind of a response against COVID infection. If you take in that tangent, now around 40-45 should be immune. There was one modeling, generally you say 2/3 of the population, around 66% will have to have immune response to develop herd immunity. There was one mathematical modeling with which they said, in a country like India, where demographic is totally different, it's like more are younger. Less than 20 years, we really have around 40% of our population, and more than 65, 4%. So in this kind of a demography, around 45-50% immune response should more or less ensure herd immunity. Taking that into one end. Other thing is our youngsters, school-going children, we didn't expose them. Did they get it during the lockdown? If so, then it's good. When you open up, if they are not immune, obviously they're all going to get it. And once they get it, who are they going to give it to? Elderly in our homes. Because India, The grandparents look after the grandchildren. If that happens, we'll definitely have a peak. Or if they're already immune, majority have some kind of immune response, this will not happen. So at this point of time, I don't know where I stand. I'm on a rope. I could be crossing that or I could fall again. So we just have to wait for some more time to be sure. We have to take the protection, wait and watch. Like by then, if you immunize all the elderly, even if the children develop infection, it's going to be mild. Nobody is going to suffer. So the idea is next 2-3 months, we should vaccinate all the vulnerable. Open the schools and colleges. Then we can all be safe.
That's a very nice, very interesting to know also, like, next 3 to 4 months, if we can manufacture enough vaccine and take care of the elderly and vulnerables, then probably we can open the school and we can almost return back to normalcy.
Almost, more or less, we are returning back to normal except for schools for the smaller children. And because they are the ones who will spread it faster. And that's something which you don't need to give vaccine to all of them. They are not going to become sick. But imagine if you can kind of protect the elderly, everything should be fine. And that's only 30 million population. This is like going in billions. The difference is phenomenally huge.
That's interesting. So what is going to be a new normal, Dr. Sridhar? What type of preparedness you have in your ICU setup now after this pandemic? Maybe this may not be the last pandemic. There may be a second surge. There may be another new pandemic. Or there is some complications due to the present pandemic.
I think definitely we are better prepared now, having been through this. We have more equipment, we have more ICU beds. So previously people did not know about ventilators or ECMO or oxygen therapy and oxygen cylinders and pulse oximeters. Nowadays, if you look at it, pulse oximeter is almost like a thermometer. Almost everybody seems to have one at home. Clearly the amount of awareness has increased. And I think if you say that there's a silver lining, yes, I think first time people are focused on their health. For the first time, the government is investing in health. The government also has done a huge amount of work, purchasing a lot of equipment, ventilators, and all this will overall improve healthcare also. So once the COVID crisis passes, I think we will have more amount of equipment to benefit other people are getting admitted for intensive care. New normal, I would like to think this would be over in the next few months, but I thought the same thing this time last year it would be over in a few months, so I was wrong. So we'll have to wait and see.
So Dr. Ram Subramaniam, your specialty is infectious diseases and you have been treating different kinds of infectious disease patients. And from your end, how are you going to look at the new normal?
I am very, very hesitant to say that, whether we will go back to the old normal, but there is definitely going to be a new normal. Till we get to the level of herd immunity against all this, we still need to continue wearing masks. We still need to keep social distance of about 2 meters. We still need to ensure hand washing and still need to avoid crowding, especially inside the house, inside the halls or religious places indoors. So this I feel is likely or is necessary for several months. I don't think it is happening, but if it is necessary and if we adhere to it, the chances that we may be able to get rid of this quicker is definitely more promising.
Dr. Vijayalakshmi, is there anything from your end on the new normal?
Well, one or other will come. It will be COVID virus. We had Ebola before that. We had Zika. Something will come. So we should be prepared to handle that. And we have faced a big epidemic now. So we are more prepared. Next time when it comes, we should be able to handle it in a better way. And my final suggestion is just don't look into social media and assume things. Because some people write because they don't have anything else to do. So look into authenticated websites. For example, health related information, go to WHO. Government is having national health websites. Our Tamil Nadu government has it. Go into it and get the information from there. If you don't know, ask the experts, talk to your doctors. Don't assume stuff from the net or WhatsApp messages and don't keep forwarding it. You have a responsibility and be responsible.
There is a lot of uncertainty still about COVID-19. And it is no more a seasonal disease, it is a perennial disease. And there are a lot of pandemics which have come in the past, and there may be some more pandemics to come as well. So the bottom line is, from what we hear from our experts, we need to protect ourselves and we have to follow all the safety precautions as it has been discussed today. And most important than all, apart from guarding our physical health, we should also keep a financial backup. If at all an admission into a big hospital is required, and if there is a complication, it may run into several lakhs, and people have to lose their hard-earned savings, or they may have to borrow money to meet their healthcare expenses. So this can push the people into poverty. So health insurance is a sort of collateral security. And in India, hardly 10% of the people have some form of health insurance. So I believe that this health awareness should promote people to go in for a health insurance, and every one of them should stay healthy and have a financial backup.